So what we've created is really an all-inclusive lifestyle approach. So someone can simply join our community, move from a private residence in most cases, into Fountaingate, a beautiful high-end independent living community, and they are in a sense buying into the whole system. So should someone need the supports and services of our assisted living facility or our nursing home, which we call the center, they will have paid for that up front. And that's
Hello, everyone. I'm Ron Roel. I'm the host of 45 Forward, where my mission is to help you make the second half of life even better than the first. Most of us want to live independently for as long as possible. But what happens if we also wanted the security of knowing that if our needs change, we'll be cared for in a familiar place, surrounded by friends and community? That's where life plan communities come in. In today's episode, I'm talking with Stu Almer, the president and CEO of the Gurwin Healthcare System, which includes Fountaingate Gardens on Long Island. Now imagine it living in Fountaingate, a continuing care retirement community, CCRC for short, where your daily worries, home maintenance, what's for dinner, even what happens if your health needs change, are replaced by connection, purpose, and peace of mind. Today we'll explore all that with Stu Almer, how life plan communities like Fountaingate are helping older adults not just live better today, but plan for the future. So now let's meet my guest, Stu Almer. Stu, welcome to the show.
great. Hi, Ron. Great to be with you here today.
Yeah, great to have you. So let's start. Now, where we are in New York, people are perhaps a little less familiar than across the country with continuing care communities, retirement communities. They're across the country now, and people know about they know about assisted living, independent living, skilled nursing facilities. But let's explain how Fountaingate fits into this picture, specifically with Gurwin.
So for Gurwin Healthcare System, we've been able to develop a life plan community, which puts all those pieces together, Ron, that you mentioned. And so for us, we're creating a lifestyle. Unfortunately, we're not yet as popular in New York with this concept as other states. But when folks understand what's involved, they realize it's very good safety net approach and quality living. And we know in our 3 years of existence, it works. And I'm happy to describe that. So what we've created is really an all-inclusive lifestyle approach. So someone can simply join our community, move from a private residence in most cases, into Fountaingate, a beautiful high-end independent living community, and they are in a sense buying into the whole system. So should someone need the supports and services of our assisted living facility or our nursing home, which we call the center, they will have paid for that up front. And that's based upon the model that they choose, and we can certainly, get into that later. But folks join us. They need to be independent in terms of their living. People can utilize assistive devices, but for the most part need to be independent upon moving in. And again, it's relatively newer concept in New York. A lot of education needs to be done, and it's working. It's just a process that we need to follow and do a good job with education of the community.
Yeah, I think that's when, well, certainly, I think one of the issues, as you get older and you say, well, okay, perhaps I want to move out of my house into some sort of community. They go into independent living or retirement community. But then there's a possibility that things might change for them. And one of the things about Gerwin's is that all these facilities are on one campus, right?
Yeah, so we're known for our healthcare. We're we all the life plan communities, we offer the same services, but what distinguishes Gurwin is our size and scope, and we have a very rich history being known for quality healthcare. So we only opened our independent housing piece, Fountaingate Gardens, just over 3 years ago. So we already had all of our healthcare services, which are well known, and now we added this component. So people that choose us know they're receiving quality care, they'll have access to that care. And in the few years we're open, we are already seeing, folks who something has changed with them or their partner or a spouse, and they need to move along within our continuum. And it works. And it works nicely because it's on a beautiful 36-acre campus. Easy access to the other facilities. And we try to make a transition when it needs to happen as seamless as possible.
So you say it's a large campus. How many rooms do you have, and how does that work?
So Fountain Gate is comprised of three buildings. They're all interconnected, which makes it easier for folks to, navigate. So two of the buildings are residential. The total size is 129 apartments. So there are 102 in one building called Parkview, and the other is 27 units we call the terraces, together 129. And there's a connected, beautiful clubhouse. Buildings have underground parking, above parking as well, but underground parking. And again, easy access to everything that we have here. We've created beautiful pathways and gardens. So, and we did that last year. We've added a lot, and we see the members every day, walking the grounds and enjoying the serenity that we have here.
I'll talk a little bit more about that in a minute, but let's talk about how you get into the community. What's the application procedure like? What are the requirements? The financial issues first.
So a typical member will come to us moving from a home residence. And you have to look at the payment. It's an entry fee model, and you have to look at it as if you were buying a home, you were paying a fee to live here. So when I say all-inclusive approach, I could jump to that piece, and that has to do with everything that's included when someone comes here. So whether it's use of the fitness center, whether it's use of the heated saltwater pool, all the amenities that we have are included. But a choice has to be made in terms of size and type of apartment, and prices vary, significantly. Whether someone wants a waterfront property, we have beautiful fountains on the campus, or whether someone wants a smaller apartment and they don't want a terrace. And so it varies quite a bit whether they want a one-bedroom apartment or two. But we can model this to best suit them. So there's what's called a life care type A contract, which means that someone would pay a fee one time up front, individually for them and their partner or spouse, that buys them that life plan access unlimited for life in any of our programs. So, for example, a couple comes in, something happens with the spouse, they need to go over to our assisted living facility, they move over, it's already been paid for. They've already paid to live within the system. And the other spouse does not need to leave Fountaingate Gardens. And they don't pay anything extra for that. That's the beauty in this. The apartment comes back to Gurwin only when it's fully vacated. So we take care of the sales part of it, but the money's anywhere between 50% and 80% of that entry fee comes back to that individual, or it's bequested to family members. So again, it's not much different than buying a home and then selling a home and having those proceeds. We also offer what's called a modified Type B contract, which means that anyone who moves in and pays an entry fee is automatically entitled to 60 days lifetime of coverage in the assisted living or the nursing home. So they don't need to pay for that extra package, which is costly, but it covers the lifetime of care. For those individuals who have long-term care insurance, they might want a modified B contract and not purchase the extra lifetime package because they've already well insured and well covered. It's not necessary. So we work with individuals when they come in and they express interest in our community, what works for them. We'll look at their insurance, we'll look at their assets. Someone does have to medically qualify to live here. They have to financially qualify to live here. It's beautiful independent living, so we've got to make sure, the individuals, meet that criteria.
Right. So when they come in, I'm sure they sit down with you and they sort of check you out, and I guess you give them access to, you're a strong, sound community, financially sound. So what sort of questions do they ask you? What are they concerns? I mean, they're selling their house, they're moving there. What are some of their concerns, and how do you address them?
Well, they want to know, they want to have a good understanding of what's included. And so, first of all, we do a very good side-by-side comparison. We have what we call it gets called an optimizer or a calculator. But basically, it's a side-by-side comparison, comparing their expenses today at home and what's included in our package. So, the beauty of this and the ease of living here is that taxes are rolled in, utilities are included, food for the most part is included. Again, use of the amenities like I explained before. That you receive the parking spot as part of it. So they need to have a good understanding of what's included here because someone might initially say, wow, this is expensive. But when you look at the cost of the phone and the TV, the internet, and all of the other things that they are now paying for, it often becomes very affordable for folks. So that's an important question. They do want to know if something happens to them, what's the process? How do they move along to the other entities that we have? We explain that to them. It's not something that we want to see, but nature happens, and we need to help people move along to be in the right setting. Um, we find that the individuals here, they're looking for socialization. We know a lot about our members, and they want to be amongst people. The bigger building is actually the most popular because there's just more people and more activity. If you were to see the beautiful dining hall, and it's exquisite here, which I know you've been to our campus, it's extraordinary, and everyone comes down for dinner. It's actually a meal credit program, almost like being at a college, where you have an opportunity if you're not using the dinner because you're away for the week. You can pool those credits and use them else, at another time during that month. Even a guest can even dine off of that card. So it's nice. It allows families to come in to be a part of it, which is important to our community. And again, everything's really designed to be made easier. When we talk to our members all the time, we call them members, and they very often will say, "Oh, it's so easy. I don't have to worry about who's going to mow the lawn. I don't have to worry about paying this bill. Um, I never even turn on my oven." We hear that a lot. We say thank you so that we don't have to replace it. But it really works very, very well, for them. So those are some of the questions they ask. If I have a medical appointment, how can I get there? And we help them with that. In fact, along those lines, if anyone needs health services beyond what Gurwin offers, um, we are in a location that is prime for all the tertiary care medical centers who have health centers right here on Comac Road in Comac. So whether you need services of Memorial Sloan Kettering, Catholic Health Services, or Stony Brook, they're all right here. We have three hospitals that if folks need to go to a hospital that, are kind of shared where people go. It includes Huntington Hospital. So healthcare is our thing. It's a great location for it. One of the nice amenities that we have now, we've done a lot of special things here. We have our own in-house pharmacy at Gurwin. That pharmacy has grown over the years. Our pharmacy serves all of our buildings. So even if you live in Fountaingate Independent Living and you want us to fill your prescriptions, we'll do that for you. We do it for all of our communities. We know that no one else is doing that. We have the wherewithal. Again, because of our size and scope, we can do more.
It's interesting. You mentioned earlier about, when people initially look at the price tag, they go, oh my gosh. But as you do that side by side comparison, when you, and it's interesting because, when you talk to people about in their 50s, like, okay, how do you want to age in place? People will say, like 80, 90% say, oh, I want to age in place in my own home, the comfort, security of my own home, which is fine. Except as you get older, things change. You start realizing that, okay, how do I get the lawn done? So, for example, the other day, I have a very nice house. All of a sudden, a leak springs, in one of our pipes in the basement, and so it's like, so there is a time when I think a lot of people say, you know what, this has been great, but I want to, I want not assisted living, but assistive living. So that's, you want to be independent, but these things are taken care of, and it's sort of it's but it's not retiring in place in the sense that I think people. So this is the other issue I want to talk about to give us a sense, a little bit more about the lifestyle there, because one of the things, especially as you get older, is number one, mobility. You know, you need to have a. People talk about you want to be in a walkable community, so that's what you offer between, and you want to offer sociability because, again, as people age in place in their house, they tend to get more isolated. That's what happens.
So we have staff who are dedicated here. One is a personal trainer full time. And so you're also entitled to utilize the personal trainer. So if you're using the gym and you're paying for that, now you not only get it, you have the access to the personal trainer for X hours per month. We have also and lifestyle enhancement staff, and their goal is to keep people engaged and involved. So, as an example, we have an art room. In fact, one of our members who lives in our community, her name is Maddie. She's an artist, and she runs that program. Many of our programs are member driven. We have a library, and we have a book club that runs out of the library. We have all types of classes. We take members on trips, movies, theater in the area, to the beach in the summer, shopping. It's just all the things that people want to go and do and enjoy outside. But even on the campus itself, we installed last year a dog park. So we're pet friendly. If someone has dogs, someone just moved in with two little chihuahuas, and they're loving the dog park and the grounds. We just put in 2 putting greens. So if you like golf, you can come out and swing on the putting greens. We installed not so much for activity, but electric vehicle charging stations, and the gardening is exquisite, and the grounds. So we just keep adding things, whether it be benches for comfort, walkways. It truly is extraordinary. But the programming is key because the programming is the socialization, the fun, the trivia games, all of those activities. And it's interesting. Our property, we've only opened 3 years. Many of the initial members who moved in all got to know each other very well and networked during COVID over Zoom. So the day they were finally able to move in, they had already established relationships. And there's a support system among each other. And when new members come in, it's beautiful how existing members embrace them. And I'm mentioning that because if you're interested in a property like ours, we involve existing members to really demonstrate to prospective members what it's really like here. And it really is warm and friendly and engaging. But that's Gurwin in the Gurwin way, from the top down. That's important to us in the training of our staff. So whether you're in, our assisted living facility, our center, or you work for our home care agency, how we work and take care of staff is significant for us. We're a large organization. Gurwin, we have 2 adult daycare programs, 2 home care agencies. We have a dialysis center, a ventilator care unit. There isn't anything that we don't provide in the post-acute care world.
So let's talk a little bit about how you run the facility and how you learned how to do it. I mean, I know that when I visited, I know you have staff meetings, and you start off every day with a sort of a team huddle. Talk about what it takes to run the facility.
Sure. Well, the facilities that are providing care, we typically have morning report. That's pretty standard in the industry. So that team gets together separately in assisted living and in our center, the nursing home, so we can understand what has gone on in the last 24 hours that we need to get our hands around, so that we're providing good care, consistent care. We do a very good handoff between our buildings so that we don't forget someone if they move from assisted living to the nursing home. That's important. We have continuity of care. So that we do well. But there's that same support also exists in our independent living facility because if something is changing with someone's health, cognitive status, social issues, we have to be on top of that as well. And because we're healthcare based, we're very good at identifying those needs and those changes. And we elevate them and we decide, okay, something's going on with Joe. How do we want to address this? And the other nice thing is that we can tap into other resources we have within our system. This tremendous crossover through our system of staff, programs, and services, like the pharmacy I mentioned is one example.
In one of your previous presentations on aging well, you mentioned that there are four keys that you like to that you highlight: belonging, friendship, lifestyle, purpose, and um, that having these qualities also is important to families. And I think that's one thing that is true that a lot of, you know, so while your residents are older, you really serve families because it's their children who worry about their older parents.
When we speak to the children, which they're often older adults themselves, when we speak to the children, they're so happy, that mom and dad chose us because they don't have to worry about where they're going to be over the next many years. We hear that all the time, and we appreciate that feedback. Now, the folks who live here, they're very independent, thinking and in terms of their certainly their physical abilities. So they made their decision to move here. Doesn't mean that their children were involved in it, but when the children learn about their involvement in it, we always hear the nicest feedback. And there's an adjustment period. There's an adjustment period for anyone coming into any one of our programs, but almost everyone adjusts very rapidly. You know, folks make friends, almost instantaneously. And again, it's almost like a college experience. You have people around you, and these are going to be my friends and my family around me, and we have those. We have that here.
So I can imagine some of the adult kids coming by and saying, if you guys are going to go on vacation, can I stay here for a while?
Well, it's their home, so it's their life. They can bring in their pets. A lot of people coming and going. And it's just a really nice active place. So we want to see the families as part of it. In our nursing home, our center, we're right in a very small, warm community here. And anytime you'll walk in just through our main lobby or out on our patios, so many family members are visiting from the community, and we love seeing that. Our customer is the family. Our customer is the public, and not just the members who live here.
So let's just take a step back. So tell me a little bit about yourself. How did you get involved in healthcare and involved at first Gurwin and Fountaingate?
So I've always had an interest, personally in helping people. I thought I would be a social worker. I was a sociology major in terms of my college background, but I saw in myself leadership ability and liking to take charge and help others. And so healthcare management for me was the career where I felt I needed to be. And I've been in that career all along. I never changed careers. But I did spend the first half of my career on the hospital side in acute care and the latter half in long-term care. I'm licensed as an administrator. I was in operations for decades, and then fortunately had an opportunity 10 years ago to come to Gurwin with a plan to be president and CEO. So going on 8 years in that capacity, and it's a lot of fun day to day being able to lead this awesome organization.
So what do you think going forward? Um, what do you think the next generation of retirement communities are going to look like? Is Fountain Gate a model?
Well, it is a model. We know it works. We know it works because we see that movement and we see the nice feedback from our members. But the market is changing. There is was tremendous building several years ago of assisted living facilities, and so now there's almost a glut of assisted living apartments out there. So it's made it a little challenging for those of us in that space because it's very competitive and we still need to fill our units and our apartments in order to be viable. So, folks interested in assisted living facilities have an opportunity now to negotiate, and it's very competitive to come in. Fountain Gate has helped us to fill units when people need our assisted living. So again, having the transition, works for us. One of the reasons we've been successful is because as we've grown, and we've grown very well over 35 years, is that anything we've created, whether it be a program or a building, fits well within our mission in the service industry. We haven't done anything, you know, crazy outside of what we do. And if you go through challenging times like the COVID era, like the financial crisis that followed, and the staffing crisis that has followed, if you're big and you're diverse, such as we are, and also if you're run a good organization, you could withstand those forces. All of our companies, there are 7 companies that comprise Gurwin. Fountaingate is one of the 7. They're all nonprofits. We work very hard. We're focused on quality, on care, on staffing in the nonprofit world. We fight very hard for our funding that we need to stay viable, and that's allowed us to be where we are in this position we are in today.
Yeah, it seems though that it's catching on, but there's not enough forethought going forward for a lot of people as they get older. I've covered this, well, not industry, but this field for a while, and I have a caregiving navigator guide, which does include Fountaingate as it's for Long Islanders, so I have options and explain different options. But it still seems like there's a real lack of comprehensive education of how to age well and what the options are.
People like to think they're not aging, right? We all believe we're independent and it's not us, it'll happen to somebody else. So planning when you're not in a crisis is really a key mantra for me that I always state. Plan for the future. Uh, Hopefully you have a sense of where you and your partner are, that maybe you'll need assistance at some point, or it's a process and they'll recognize things are getting more challenging at home. This might be an easier option for us. And we find folks that come to us that are initially interested. It takes time. It's a process before they realize, okay, this is the right decision for us because, we need a little assistance. We're independent, but we kind of see where things are going. So recommending that folks visit communities, again, plan when you're not in a crisis. A lot of what we offer in our organization, people don't like to shop for, right? But when you do, you'll find you made the right decision. I've been through this twice with parents who were aging and had since passed on, and being able to plan has made tremendous difference uh, for them and their well-being for years they had left, and for financial planning. So try to start early, assess your own needs. You can set a budget, and in terms of visiting communities, we tour 24/7 here, but we'll also make arrangements to have people do a trial stay. We've had folks come from out of state or even locally, come live with us for a couple of days. You'll see what it's all about. That'll be the best test of, are you comfortable here? Do you like the people living here? Do you feel like you're going to fit in? Is the staff warm and attentive to you? And that usually works. And we do that without any additional charge to anyone. I always say this, we help far more individuals in the community who will ever utilize our services. We're here to help people. We're in the people business. So we help people. We hope by doing that, they'll utilize our services. I mean, I'd like to share something new. We just received a significant training grant that Gurwin will be the trainer of certified nursing assistants and home health aides across all of Long Island. We will be the training site over the next 5-year period. This is significant. We'll be able to train staff who will be working for us, hopefully, uh, in the Gurwin way. And if they like what they see here, they'll be able to stay on with us. But regardless, they'll be trained well for Long Island. So we feel good that we're doing our part to help the community as well.
Yeah, I think that's important because one of the things that's constantly come up is, um, the dearth of qualified staff. It's not something that people normally think about. So a lot of communities are really recruiting and having some issues of getting enough staff.
So I'm especially proud because we recognized that was going to be the key to get through a rough period, and that's monitoring our staff turnover. I will share with you, because I have the latest information, Gurwin, across our entire continuum, which is almost 1,200 staff, we are at a extreme low of 22% turnover. So if you monitor turnover and you know industries where I'm bragging a little bit here, but not only better than our own industry, we're better than most other industries. You know, long-term care, we were at an annual turnover rate, all of us, upwards of 50%. We have made great inroads. And that's come with a lot of initiatives, a lot of change, and it's working. So we want people to come to us. We want them to stay with us. And thankfully, it's working. I had a town hall meeting with our nursing home staff today. I met with over 200 staff in a forum. I'll be doing one again a little bit later. And I was able to share with them that you're here and you're staying with us. And we've worked hard to keep you here. It's that caring and that commitment from the very top and through our leadership team and our management that makes a difference here because it's our staff who are taking care of our members.
Yeah, I think I had a conversation with someone who runs a home care agency, and we were talking about staffing, and I think that it's true. I think with um, well, healthcare organizations like yours, but also I think really generally, if you want to go into a company and you check them out, look around and see how they treat their staff, and you'll have a pretty good idea of how they treat their customers.
Just in a given day in any one of our programs or buildings, you're going to come across potentially hundreds of people, whether it be service staff, security, food service, housekeeping, nurses, physicians. It's just constant 24/7, right? 7 days a week, holidays. And, so it takes a lot, to do this well, and staff really embrace the caring. Um, you know, it's caring and it's competence. We work hard at that. We often hear and heard it even today, that it's hard working here. It's nice working here. We take care of staff very well. But it's hard. It's hard because we want to do it well. We want to do it right. We're very heavily regulated, right? We don't want to have a regulatory issue. But staff appreciate, and that's the feedback we get. We got it this morning. How much, we challenge and we're tough, but we're nice and we care.
So, having produced this book, The Caregiving Navigator, myself, I do have an appreciation of not only what family caregivers go through, but how they need to work within the entire caring community. And I think it is really a symbol of how we care about each other as a society in an integrated way. And I think people are getting it. Caregiving is, I think starting when we care for our children, we don't think about that. We think about we're parents, But then when you have, get older and need care yourself, I think you see the spectrum and the continuum, and I think it helps to have models of, well, how is this done well?
I often say this, in our, amongst our staff when we have discussion, folks who join us, it starts with caring for people. You're here for a reason. You're here because, something motivated you to take care of people. So it helps to have that start. We're seeing changes in trends in people who join us, whether it be from different countries or different ages. We're seeing more males join our workforce, which is interesting. Um, I think there are just great opportunities for people who maybe been through a tough time, and it's a way of giving back to now join our organization, that it's safe to be here after being through very, difficult times. And so it's just interesting. We're following the trends. Don't know what we always do with those trends, but we follow them because that could also be key to our future. We're very involved with all of the local college, universities, and trade schools. We embrace education and training far more than any other organization. So anyone who comes here will see students from many different programs, social work, nursing, from all of the universities, because we recognize that's the future of our workforce, and it's working. So it's really getting our staff to understand how important it is that this sacrifice to train, because it's a lot of work, will help them in the long run in their own recruitment. And it's nice now when we can look back and say it worked.
Well, thank you for your work, Stu. It's been a pleasure talking with you. If have people have questions for you, or want to find out more about Fountaingate or about Gurwin in general, what's the best way to reach you and your people?
Sure, Ron. So certainly for independent living, the website is www.fountaingateli.org. I'll repeat, www.fountaingateli.org. or for all of Gurwin, www.gurwin.org, Gurwin.org. Even if you just go on gurwin.org, you'll find a link to everything that we have in our system.
People are interested in following up with you and they like your ideas and get your thoughts on things. What's the best way to contact you?
They could actually reach me easily through our website. It's easy to send an inquiry, and our corporate communications team will certainly turf that over to me or the appropriate individual who will very gladly respond. And we always follow up, we always respond. One of the keys to our success is the follow up, and we do that really well.
Well, following up on my behalf, I want to thank folks for spending time with me and Stu and helping me make the journey through the second half of life even better than the first. You can see a full archive of my shows or see what's coming up next or where I'm going by going to 45forward.org. And you can feel free to send me comments, questions, suggestions for future shows, or sign up for my monthly newsletter. Just email me at ron@45forward.org. So, folks, until our next episode, keep moving forward, 45 forward.